let's get this nice and big for you all here. All right. So welcome everyone. We are Corewell Health-Taylor. I will note there are two Corewell Health PM&R programs. We are the one in Taylor. Do not get us confused with our colleagues up in Royal Oak. We are friends, but we are very different. Excuse me, my screen just disappeared. We are very different ultimately from our friends up in Royal Oak. All right, let's dive right into it. Okay, so briefly, here's our program leadership. We do have you, as you can see, we do have a quite small group of core faculty here with 7 faculty. We recently had some change to our program with our APD, Dr. Melissa Mafia, becoming our program director this year, which has been great because she grew up in our program and she really knows it inside and out. She's really making some great strides to kind of improve the program and grow it into the future. This is us. Hello, my name is Juliet. My co-chief is Sena. We will both be talking to you tonight. And these are our group of lovely residents. We are a categorical program. These pictures here are our PGY2s through 4s. As you can see, we have 5 residents per class, which makes us a total of 20 residents with those 7 faculty members. And here's pictures of our intern class, as well as our brain injury fellow. We are the only brain injury fellowship in the state of Michigan. So briefly about the program, as I mentioned, it is categorical. That first year is a transitional year, kind of attached to the PM&R residency. The interns do join us for didactic lectures, but on their rotations, they're working mainly with the consultants that they'll be reaching out to during their rehab time. We do have 5 residents per year, or 20 total in the program, and we are the only brain injury fellowship in the state of Michigan. We have full accreditation and no citations. So some information about our primary site. We mainly work out of Corewell Hospital-Taylor, where we have a 49-bed rehab unit. There are 2 units. There's a 14-bed locked TBI unit, neurotrauma unit, and a 35-bed general rehab unit up on the 3rd floor. We are based out of a community hospital with multiple levels of care accessible within that hospital. So we have our 2 rehab floors there, but we also have an acute care hospital attached. So if there's a medical emergency, we're able to quickly get imaging and transfer them over to the acute side with very minimal delays there. We also have a surgery center in the same building that primarily does a lot of orthopedic surgeries, which is a great patient pool for our rehab center. We also have an in-house LTAC where we do see consults and we do care for the trach patients there. We do also receive patients from 2 level 2 trauma centers that feed our rehab. And we have a relatively high case mix index. Most of our patients have 4 to 5 comorbidities. Our area is very multicultural and very multilingual. We have a lot of Spanish speakers in the area, and we also have the highest Middle Eastern population in the continental United States, just at the next door suburb in Dearborn. We have a lot of Arabic speaking patients as well. You will be rounding one-on-one with the attending, so you do have a very tight relationship with them and also a lot of autonomy early on in that situation. So when you're on a rehab team, of which we have 4 rehab teams in our IPR, it is you and an attending running that team. So you have a lot of responsibility very early on, and that autonomy grows as you progress through the year. We are home call only with a house physician in the hospital for emergencies. But we only have to go in for backup and pump emergencies, and you're only doing that overnight call in PGY2 year. That does mean you don't get a post-call day though, so you do have to come into work the next morning after taking that overnight call. And we do take our weekend call primarily in PGY2 and 3. There's 2 weekends of weekend call in 4th year and a few scattered weekends in PGY1, according to which rotation you're on that transitional year. Corewell-Taylor is one of our 4 hospitals that we work out of primarily. This is the former Oakwood system here in Southwest Detroit. So our main hospital here is Corewell-Taylor, but we also work out of Dearborn and Trenton, which are 2 level 2 trauma centers, as well as Corewell Hospital Wayne. Where are those located? So here's a lovely picture of Detroit. You can see Taylor there outlined in red, and our hospitals are going to be located at Taylor, Dearborn, Wayne, and unfortunately missing from this map, Trenton, which is about a 20-minute drive from Taylor. So relatively all centrally located around there. And this is kind of the same places where residents tend to live in our program, primarily in the Dearborn area, in Taylor a little bit. Some folks like to live further afield, either in the city, in Detroit, out in Canton if they have more families. or even as far north as Ferndale, Royal Oak, which is about half an hour drive. So we're really kind of scattered throughout the Metro Detroit area. Any place that's happening in the neighborhood, you can find one of our residents. Some rotation highlights for us then. So going through our PGY 1 year, it is a TY year. So you are going to have 6 months of internal medicine. 5 of those months are going to be internal medicine teams and 1 month on the ICU floor. Then the other 6 months are going to be rehab relevant electives. Those are not chosen by the PGY 1. Those are prescribed by the program. And that's going to be emergency medicine, rheumatology, neurology, neurosurgery, radiology, and trauma. Our PGY 2 year is our heavy year for inpatient rehab with 9 months of inpatient rehab, 2 months on consults, and 1 month of neuropsych, which is great to get to see how those testing procedures go when they're trying to anatomically map epilepsy, for example, in preparation for epilepsy surgery. In our PGY 3 and 4 year, we do start growing into the outpatient experience a little bit more, as well as returning to some of those rehab relevant electives with orthopedic surgery and neurosurgery, especially, as well as interventional pain and pediatric rehab. We do have one true elective month each in PGY 3 and 4, and we have options ranging from cancer rehab, sports, palliative care, radiology, all kinds of options. Basically, if we don't already offer it and it's something you're interested in, we can work to set that up for us. In our 4th year month, we also have a multidisciplinary month where you're able to spend some time working in a subacute facility and also in an LTAC. And finally, we have a board review month just before graduation. You also have a junior attending role in the first 5 months of the year. One of our PGY 4s is on the inpatient rehab floor with the PGY 2s to provide support and act in that junior attending role for those residents. Time off. We're all here trying to get a residency program to learn how to work, but everybody wants to know about the time off, right? So we do get 20 days of vacation, which is awesome. You can take those on any schedule you'd like. Some programs, you have to take a week that starts on Sunday and ends on Saturday, and not so in our program. You can take one day at a time. You can take every other Friday off for the full year if that's what you prefer, up to 2 weeks at a time so that we can keep within ACGME requirements. There is a minimum 6-week notice, so you do not have to have those all planned for the year at the beginning of the year. We do get 5 conference days each year. Those do not count as time away from our program. And if you are presenting at the conference, you do get travel, hotel, and food covered for 2 days, the day of your presentation, and 1 day either before or after. There is preference given to residents who are presenting at a conference before other residents who are not presenting are allowed to apply to attend that conference. But historically, that's not really been a problem. The people who are interested in going to conferences are able to. And our residents go to international and national conferences with this, all the major PM&R conferences, as well as sports medicine, International Association for Advanced Medicine and Science, for example. And that's very well received. We do get 2 wellness days per year as well. That does have to be with a wellness appointment, be it doctor's appointment, a dentist appointment, or a mental health appointment. As long as you have that appointment, you get the rest of that day off to do with as you will. And we do get 5 interview days in PGY 3 and 7 in PGY 4. So some benefits then of our program. We do get an education stipend, which is $800 for PGY 1, which just about covers that step 3 or level 3 fee there, and $1,200 every year after that, which does roll over, but does need to be used prior to graduation. We also get $1,800 in food stipend per year. You have the choice of taking that as a direct payment that you can use in the hospital cafeterias. We do have hospital Starbucks, which is very nice. Or you can get that added onto your paycheck, in which case it is taxed. We get free snacks in our resident lounge, professional journal subscriptions, and association memberships. There's also a Lyft service for resident fatigue, so that if you're too tired to drive home after an overnight shift, that you're able to charge that Lyft to the hospital. And we have free parking at all of our clinical sites, which is a very nice perk. Going into our didactics, then, we do have Thursday afternoon didactics from 12:30 to 4 p.m., 3.5 hours. That includes hands-on workshops as well as active learning techniques that all of our attendings try to use to keep from just being lectured for 3.5 hours. It is a 12-month curriculum with textbooks provided by the program. You get certain textbooks in each PGY level, and it progresses with you. So the board prep books are in PGY 4, for example. There are resident academic presentations, which are required in our program, an M&M in your PGY 2 year, a journal club, and a case report in your PGY 3 year, and finally a grand rounds presentation as a PGY 4. And the PGY4s also are given more in-depth board prep and career prep education with a mock oral boards and board prep course, as well as billing and contract evaluation teaching by the attendings. Our residents have gone on to very distinguished fellowships at some really high name institutions around the country, as well as some very niche specialties such as cancer and performing arts medicine. Um, and research and quality improvement is a huge part of our program as well. Research is not required, but it is very well supported in our program. There's multiple faculty projects to join. We have a biostatistician who can provide support, and the residents' own research interests are supported as well. There's been many projects that residents have wanted to give a shot, and they've been very supported in figuring that out, going through IRB, all those different steps of setting up a a research project. Resident posters and podium presentations are consistently accepted at both national and international conferences. As I said, if you're presenting, you do get your travel paid for, so that's a great incentive to be up on your research. And our quality improvement curriculum is designed to promote professional development. You get support from the department leadership to make policy changes on the rehab floors if that's needed for your QI project. And we do see our residents present those QI projects at national conferences fairly regularly, which satisfies the ABPM&R requirement for a QI project within your first 5 years of board certification. If you have your residency project presented at a national conference, you're good on that requirement. And last but not least, in our program, we're a family. So I'm going to turn it over to my co-chief, Saina Gawani, to take us into the fun things to do in Michigan.
All right, I get the fun part. Let's get into it. All right, lots of fun things to do around Detroit. To start, we've got lots of sports teams, and our sports teams are actually doing quite well. So it's a good time to be living in Detroit. Lots of things to do, including going to all of these various sporting events. Thank you, Kyra. Fall in Michigan. Of course, fall is beautiful in Michigan. We can see pictures of apple orchards. We've got pumpkin patches. That corner at the bottom left, that's Mackinac Island, which is couple hours drive, few hours drive, but absolutely beautiful in the fall. And then, of course, we've got a plethora of cider mills. Um, Weather here in the fall is just wonderful. Can't beat it. Winters in Michigan, of course, it's kind of a tundra. It's very cold, but still lots of fun things to do. Our program actually went skiing the last couple years. One of the attendings offered to take us out, so we all went skiing, and you can see that picture at the top left and in the middle. A couple of our residents doing that. We have an annual Christmas party, which is really fun, paid for by the attendings as well. You can see that in the right-hand top corner. Other snow activities, and then in the bottom left, you see the ice rink that we have in the middle of Detroit, and that's really fun to go to with friends, family. We've done some Christmas gatherings amongst the residents in our programs right around the Christmas tree. They've got some lodges and things like that to do in Detroit in the winter. Summers in Michigan, of course, even better than fall or winter. Starting from the top left, we see Eastern Market, which is a pretty big farmers market we have here. We can do kayaking in Ann Arbor or surrounding areas. The Fox Theater is here. Going kind of around in a circle towards the right, you see a picture of Pictured Rocks, which is 4 hours away driving.
I think
Juliet,
that's right. I think
correct me
four
if I'm
hours away.
wrong. Traverse City has the National Cherry Festival. There's the Detroit Zoo, which is really open all year long, but has a bunch of events in the summer. We've got Henry Ford Museum, which same deal, open all year long, but lots of events in the summer. And then Sleeping Bear Dunes right there in the middle on the left, which is a great hike, great views. Also, I think 3 hours away, so not too far, good enough for a weekend trip. And then the Upper Peninsula, a little bit further away from us, but still amazing views. In the middle again is Pictured Rocks. And we got our 5-minute warning. So I'll wrap it up here. Just lots of pretty views, lots of things to do in the Upper Peninsula, a little bit of a different experience from kind of the city life of Detroit. And at the bottom, you see our Instagram handle. Feel free to follow us. And we are going to open the floor for any questions.
I'd also encourage you all to check out our website. There's information about the salary there and the contact details for our program manager, for example. Any questions? I'm gonna stop here we go. You want to take that one, Sana?
Sure. So the question is, how does Corewell-Taylor support residents in engaging with the local community, whether through adaptive sports, outreach programs, or partnerships that help patients continue their recovery and reintegration beyond the hospital setting? That's a great question. So a lot of us do have involvement in adaptive sports, whether that's adaptive weightlifting or adaptive track and field, volunteering for adaptive programs or competitions, things like that. They're all over the place. We've got Mary Free Bed near us. We've got University of Michigan near us. They've got events going all year long. So lots of volunteer opportunities with that stuff to get involved. And then sports sideline coverage is also a great way to kind of become involved with the community. Or I think we did like a Detroit Marathon was some good sports coverage that we had that was in the local community as well. So
We
yeah,
also
anything.
have our annual Corewell Taylor Safety Day where we have a booth with information about brain health for the public, and they're able to come and get any questions answered that they may have. So that's one of our outreach programs as well. Thanks, Musa. Excellent. Well, thank you so much, Nathan. Any other questions we can answer? We can talk about this. So, the cool recent QI project that led to changes in policy and patient care is ours. We have a policy on our rehab floor where all patients are required to get 3 post-void residual bladder volume scans at the beginning of their stay to ensure that they're not having any urinary retention. And we found that we were actually only compliant with that policy 63% of the time. So we made changes to the policy to bring it in line with the American Urological Society guidelines. And then we instituted new documentation practices as well as notification practices on the floors. And we have been able to increase our compliance up to 87% with that. And we will hopefully be submitting that to AAP this year. So if any of you are there, come check us out. Any other questions we can answer for you guys?
Thanks so much for having us. Thanks for staying on to watch our presentation.
Yeah, we really appreciate it.
Thank you both.
Thank you both for presenting.
Stop sharing my screen.
All right.